Wisconsin. Welcome to Virtual Coffee Healthcare Summer Series Part 2 VA Prescription I can't speak this morning or this afternoon. VA Prescription Perplexities. And first off, we're going to start with a few housekeeping items. So if you can hear me, there is a little box to your right with a hand. Go ahead and raise your hand if you can hear me. Thanks, Mandy. Latasha, welcome. Robin and Donald, can you hear me? Sometimes we can't see their hands, so if you cannot hear me, go ahead and send me a chat or a question, and we'll try to get it fixed as best we can. Okay, I don't see any chats or questions. So today, during the webinar, what we'll do is we'll go through each slide and we'll answer questions after each slide. So go ahead and ask away, ask any questions you may have, and then we'll stop after each slide and we'll answer all of your questions. And don't feel like you can't ask any questions. Go right ahead. I want to introduce Mr. Gary Lee. He is our presenter today from the healthcare program, TVC healthcare program. Welcome.
Bonjour, everyone. As Carrie said, I'm Gary Lee with the TVC Healthcare Advocacy Program out of San Antonio. For those of you who were with us last time, give me a few minutes and I'll give a brief history of the Texas Veterans Commission to anyone who may be tuning in with us for the first time. Texas Veterans Commission, or TVC, was established in 1927 as the state service office to assist veterans of the Indian Wars, Spanish-American War, and World War I as well. Our purpose has always been to act as the state-appointed advocate of Texas veterans as they attempt to secure the benefits rightfully earned in exchange for their service in our nation's armed forces. TVC is not a branch of the federal government, but what we are the state advocate for veterans and their families. Texas is the only state that offers as many programs as we do under one agency. Our services are free to veterans. Our agency consists basically of 8 programs. There's claims and representation and counseling, employment services, veteran education benefits, fund for veterans assistance. There's the healthcare advocacy program, the Veterans Mental Health Program, formerly MVPN. There's the Women's Veterans Program and the Veterans Entrepreneur and Business Development Program as well. These are the families of the Texas Veterans Commission, and these are the ways that we help take care of the veterans of this great state. Our staff is located throughout this state, and our advocates are all veterans. TVC established the Healthcare Advocacy Program to help with the issues that veterans were having trying to utilize the services provided by the VA, or the VHA as it were. We have advocates in every VA hospital, and we work with the clinics as well to make sure people understand and utilize their benefits. As a state advocate to the 1.7 million veterans in Texas, we are the middleman, as it were, and the experts when it comes to information regarding state and federal benefits. We are Veterans Helping Veterans. Our staff is available by phone or email, and you can also go to www.tvc.texas.gov. Now, we'll go ahead and move forward with part 2 of our summer healthcare series. This one is titled Prescription Perplexity. What we're basically going to do today is try to help people understand the things that the pharmacy and the prescriptions that they utilize through the VA, how they can help them. We want to help you understand and utilize the VHA healthcare system pharmacies to maintain and or enhance your quality of life and to capitalize on more earned VA healthcare benefits and entitlements. Okay? Some people might ask us, why are we doing these things? Or let's go with who first. Who can utilize the pharmacies and the prescription medications? veterans that are enrolled in the VA healthcare system, service-connected and/or entitled veterans who are qualified to utilize VA healthcare, and those who have requirements for prescription medications, herbals, or supplements. Now, most people are familiar with the prescription medications, but also there are some times when doctors may decide that in order to benefit your health or quality of life, they may prescribe herbals and certain supplements. So yes, the VA may provide those as well.
So, hey, Gary, who's eligible to receive prescription medications?
Well, anyone whose doctor will prescribe them for them. Like we said, if you're enrolled in the VA healthcare system, if you are utilizing it and your primary care doctor or specialist decide that you need these prescriptions, then they will prescribe them for you.
Does that mean I have to be enrolled in the VA to get prescriptions?
That is correct. One of the questions we've had in the past, people will ask, well, hey, if I have an outside doctor, a non-VA doctor, and they prescribe medications for me, can I bring them to the VA and get those prescriptions filled? The VHA system will not prescribe medicines that an outside doctor prescribed. They need to make sure this is something that you need and something that's not going to counteract other medications that you may be utilizing. So if and people regularly do that, they'll get the prescription from the non-VA doctors, and for either cost-saving purposes or purposes of convenience, they'll bring it to the VA and say, hey, can I get this prescription filled? Now, what will need to happen, their primary care doctor or specialist will need to talk to them and try to look at them and their records and see, do you actually need this medication? And if so, the VA will prescribe it. So if the VA prescribes it, they'll provide it. But they won't necessarily honor prescriptions from outside doctors without them first screening you first.
Great. And what about my dependents? Are they eligible for prescriptions?
Those are case-by-case basis. If you are utilizing the program CHAMP VA, if you're qualified, there are some programs. There's a program called CHAMP VA that will provide medical treatment to your family members. If they are caring for your family members, then yes, they will prescribe medications for them as well.
Thank you.
Okay. All right. One of the questions also that we run into is why. Why should you utilize VA prescriptions or pharmacies? One of the things I would say to you is for the preservation of your good health. If you are concerned with your health and long-term, functionality, if you want to take care of yourself, that's one of the things that you can do. Utilize your VA healthcare system, and if they're giving you prescriptions, then utilize those as well. Continuity of care. Let's say you had a procedure performed or something like that in the VA healthcare system. Sometimes there's follow-up medications. You're going to need to take this for several days, several weeks, several months. So that's something to continue the care that you receive. Utilizing the VA pharmacy and prescriptions also can help you keep up with prescription history and tracking. Prescription history is important because, like we mentioned earlier, we touched on earlier, some medications will counteract or react with other medications. So if they know everything you're taking, they know what they can and cannot prescribe to you. As you brought up earlier, if there's an outside prescription that's not known, that can tend to cause a problem. So again, that's one of the reasons if you bring an outside prescription, they're going to screen you and make sure that that's not going to cause a problem. So prescription history and tracking is another important factor. When we look at the consistently rising cost of private health care insurance and medications, that's yet another reason more people are kind of looking toward the VA. If a prescription is going to cost me $30 from one place, and if I can utilize the VA healthcare system and get the same prescription for no copay or a much lower copay, then to them it makes fiscal sense to utilize the VA system.
Yeah, even with my TRICARE, I have TRICARE Prime, so even with my TRICARE Prime, we pay a $20 copay. And that can be pretty expensive if you're on any type of continuous medication every month.
That's true. And if you have TRICARE Prime, then you're cooler than a lot of us. But like you said, yeah, that those things can add up in today's, moving economy everywhere that we can take care of ourselves and our family with a less expense. That's something that a lot of people are interested in and will explore.
And I hear that a lot, not with TRICARE Prime, but with people saying, "Well, I have my own insurance and it's really great," but that copay is always there, and the history. So for me, even if I use an outside doctor, I take that information to my primary care doctor, and to make sure that there's a history there and they know what's going on with me, and I'm not using 3 different doctors and they're all talking to each other. So
Yes, and that's good. And another thing we run into on occasion, there are some cases where you may have to pay a copay, depending on if it's something perhaps you're not service connected for, or you're not eligible for complete care from the VA. But usually, almost always, the copay that you pay with the VA is going to be significantly less than you would outside of the VA system.
oh, okay.
Yeah.
So like if I'm not service connected, but I'm enrolled and I have a certain amount that I qualify for due to what I make, then I could be eligible for some prescription help.
Yes.
Is that what you're saying?
Yes. If you're not service connected for a particular issue, or you're not qualified for full VA coverage, then yes, they take into consideration your income and those things. So they may charge you a substantially lower copay. And again, that's going to help you out in the long run.
All right, so we're at the end of a slide and we have a question or a comment. I think it's from Latasha. If you are referred out for care and the physician prescribes a veteran medication, will the VA pay for the prescriptions?
That's a good question, and yes, they will. If the VA refers you out for care through the Choice Program, or through, if they refer you out and that physician prescribes certain medications for you, yes, the VA will still screen you and make sure that it's not going to have a negative reaction or whatever. But yes, the VA will take care of that and provide those prescriptions for you. Thank you for that question.
Okay, thank you. Any other questions before we move on? No? Okay, we'll move on. Next slide, right?
Okay.
Are we on the next slide?
Yes, we can go to the next slide.
Okay.
Okay. Now, the next topic will probably be how. How can you take advantage of the VA prescriptions and the pharmaceutical services? One of the most efficient and expeditious ways is the My Healthy Vet account. That's a good way to refill prescriptions. That's a good way to make sure that they receive your request and they're going to process it. It should take them no more than 1 business day to process anything that they receive through the My Healthy Vet account.
As a matter of fact, not to barge in, I just used mine today. I love Healthy Vet. I've had nothing but success with it. That's how I order my prescriptions. That's how I just asked for an appointment today because my birthday is in July, so I get my annual checkup. So that's how I get my appointments done. I talk to the nurse, and I have nothing but love for Healthy Vets.
Good. Happy 29th birthday, and it's good of you
Yes.
that you can speak to this with actual experience. And it's for a lot of people, maybe for some of the veterans that we have that aren't accustomed to technology or computers or whatnot. I suggest that they get someone to assist them, or try to learn on their own. But it is, and again, no program is perfect, but it saves the veteran a lot of time, and it sends that request directly to the VA, and it's pretty.
And how do you sign up for Healthy Vet? I know, if I remember right, they had me fill out a form, and then I can't remember. Do you remember how to? I think you fill out a form, but if you go to the VA and see the front desk, they'll hand you a form, you fill it out, you log on, and then that's how you get access. But it's so easy to order prescriptions. They come pretty much within less than a week, and speak to your secure messaging with your doctor.
Yes, and it's the standard protocol is 7 to 10 days if they're being mailed to you.
Hmm.
Now, if there is an issue, there's ways that you can, and we're going to touch on that shortly, but there's ways that you can deal with that. One of the most important things with My Healthy Vet, yet again, it's an expeditious way to request refills to make sure that the VA is going to get it. And another thing that it can do for you, like we talked about earlier, it can help you track all your prescriptions so you'll know what medications you're on, what you've been taking. Because there are veterans who change medications. Perhaps this one has a different reaction. Perhaps something's not working as effectively. They need to be aware of the things that they've, taken, the medications they've taken. So again, My Healthy Vet is a way to track those as well. Now, for those who choose not to take that particular route, you can call the automated telephone system and follow the prompts. If you look at your prescription bottle, for those of you who have good eyesight, you can look at there's a telephone number on the bottle, and it'll tell you, the number to call, and you just follow the prompts. If you want this or that, press 1 or 2 or that type
That's
of
my
thing.
husband.
Okay.
Yeah.
But that's another way to refill your prescriptions, and that usually works very well.
Yeah. So he's retired as well, but he does not use Healthy Vet. It's easier for him to get on the phone and order his prescriptions and talk to a person. And I think it's just personal preference. Um, it's good that they have different types of ways that you can order and get your prescription and talk to your nurse.
Okay. All right. So obviously you're cooler than him. You can use a computer and he can. All right. That's teamwork. Anyway, you can also walk into the VA pharmacy if you want to try to refill your prescriptions. I've personally witnessed veterans just walk in with the bottle and say, hey, I need to get this refilled. And, you'll take a number, and usually that does happen. Now, one thing you do have to understand, it's very important that you keep up with your prescriptions. And by this, I mean, if you have a 30-day supply, you don't want to wait until day 30 before you, try to refill it. It's because you're going to deal with that gap in treatment and in medications. So, and then again, this is a busy society we live in. We get up in the morning, take our medications, and like, okay, I'm running low. I'm going to need to refill that. We do that for a few days, and next thing you know, we're out. So there are ways to deal with it, but it's so much easier for yourself and give you less obstacles if you can, try to refill those before they actually run out. Now, in situations where they do run out, like we just touched on, you can walk into a VA pharmacy and ask them to refill it for you. You might have to wait a little while depending on how busy that pharmacy is at that particular time. Now,
which is usually pretty busy.
Yeah,
unless you get there like when they open the doors.
Yeah, and
it can be.
Yeah, it can be, and we're talking statewide. In some areas, it's
Sure.
extremely busy. Some areas, maybe not. There's particular days when it's busy, when it's not. But you're right about that. It may take you some time. But if you run out and, you kind of overlooked the fact that you needed to prescribe them, you can walk into a pharmacy and request them. You can also, in some cases, walk into the emergency department and request medications. Now, usually, in the pharmacy, if you walk into the pharmacy, you can order a full refill, or let's say that you were running low, you called and ordered some, and they were going to mail them to you, but a few days has passed, and you kind of feel like, well, I need some, in the meantime. You can walk into the pharmacy, and they'll give you a few days to hold you over. What they'll do is they'll check and see, okay, you ordered them at this particular day. They kind of know, all right, it's going to take about 5 or 6 days. You have 3 days left, and they'll give you 3 or 4 days to kind of hold you over until you receive your full supply.
So what if I'm out of town? So what if I am out of state?
Okay.
Can I just go into a VA emergency room and they can look me up? And
that is possible, but it's a bit more difficult. What I was going to say, and that's a good question to bring up that point. What I was going to say, before you travel, make sure you kind of sort of plan ahead. Make sure you take your medications with you. If I'm going to be, out of town for 30 days, I need to make sure I have 30 days worth of medications. Now, if I'm going to run short, maybe I want to order a refill a little bit earlier. But That is possible, but it's extremely difficult, and it's going to be probably more time consuming. But if you push on the shove and it's an emergency, it is possible. But again, I can't stress it enough. Make sure you plan ahead for things like that. Again, sometimes they may need to send you to the emergency department to get some, some medications to hold you over until you can get a refill. Now, another thing before we move forward, people have to also remember refills are set up for a particular time. If they're going to give me, let's say they give me 30 days worth of medication, and they tell me you have 4 refills. That's set up. If I need 30 days worth, then that means that's pretty much a month. If I have 4 refills, that means this medication is supposed to last me for 4 months. There are people who kind of, perhaps they're supposed to take their medications every day, but they kind of take it every other day for whatever reason. Now that time has been stretched out. But what you can run into, maybe it's 5 months into it, and you're thinking, I'm running out of medication, I need to call and get one of my refills, because according to my medications, I still have refills. But those refills are for a certain time period. So if you've stretched out that time period, it might be 5 months, and you're looking at a bottle that says you have a refill left, but when you call to try to get it, it's telling you you cannot get a refill. So that's something we have to be aware of as well. So I've had individuals that come to me, hey, I have 2 refills left, but the automated system is not giving them to me or whatever. So that's because they, passed that time period.
As a matter of fact, that's happened to me too. And what I did, this is where e-benefits or just the phone comes in to play, but secure messaging.
Yes.
So if you secure message your nurse and just let them know what's going on, 9 times out of 10, I'm not going to say every time, but 9 times out of 10, if it's something that is ongoing and you take regularly, they will just go ahead and reset you in the system, and you're able to order that again.
You're absolutely right.
So,
now, once in a while, they'll tell you you're going to need to come in and see the doctor before they can give you an additional prescription or extend it or whatnot. But yeah, you're right. 9 times out of 10, contact that doctor or that nurse, call them, instant message them, or what have you. But yeah, you're right. 9 times out of 10, that's the way you can resolve that.
And the thing is, and this is a lot. Some people, some veterans are very proactive, and they can ask the questions. They feel like, they can ask the questions and they get the answers. But some veterans aren't. And that's just the way it is. They don't know to ask the questions, or that they can ask the questions, so they don't get what they need. So just remember, to let everyone know, and ask the question, because 9 times out of 10, they're going to help you. And if they don't, there's people like us out there that can make them help you. So.
Yeah, you're absolutely right about that. Sometimes people don't realize that they need to ask these particular questions. And the VA staff, they do everything they can to help veterans, but sometimes you have to make it easier for them to help you. So you're absolutely right about that. So to finalize that point, you can do walk-ins to a pharmacy or to an emergency department, and sometimes get yourself enough medications to tide over between prescriptions, or you can actually refill prescriptions at the pharmacies. Another rarely known process is utilizing the mail-in refill slips or the pharmacy refill request form. You can just there's a slip that you can just mail into the pharmacy. It's almost pre-printed, so as soon as they get it, they'll just look at it. Okay, this is for this particular medication. They know what the count is, and they'll just mail it back to you. Or if you didn't mail in that particular slip, there is a form that you can get from the VA as well. So whenever you feel the need, you can just mail in that form.
Wow.
So that's just yet another way. Probably fewer and fewer people are, accustomed to utilizing the land or snail mail, as we refer to it. Most people want the advantage of technology or being able to walk in and talk to someone. But that is yet another opportunity, another method, another way to get the
some folks just like filling out those forms and sending them in. That's just
that's true.
One of those things.
And if you need further assistance, there is a hotline for your corresponding VA region. Now, in San Antonio, in the San Antonio area, you can dial 800 or 1-800-983-0933. If you have questions about prescriptions or just need further help, you can call it. Now, I don't have a complete list of numbers for other regions, but if you contact your VA hospital and ask them for the prescription hotline. They will gladly give that to you. And if you have questions, they'll do what they can to answer that for you. We have any questions from that particular segment?
No, but I did have a question. I want to go back because I did miss a question. Why do some prescriptions, why can't I get, one of the questions we had was, why can't I get the same pain medication I was taking for years?
Okay, and that's a good question, because the DEA regularly checks certain medications for effectiveness to see how often are they going to react with other popular or other prescriptions. They check and see, are there is there long-term damage that this medication may be causing that they didn't know about in the beginning? And Congress works with them, and Congress sets the policy for the VA. So every so often, they just come out and say, okay, we can't give this medication anymore for this reason. Here is the substitute that's being utilized. And most of the time, you won't see the difference. Now, if there's a rare situation where your doctor has determined that that particular medication is the only medication that can resolve your issue, then on a case-by-case basis, the VA will look at, well, okay, this isn't something we normally stock anymore, but if this is the only medication that can resolve this veteran's issue, they will make every effort to get that medication to you.
Got it.
But it's just, changes come out. DEA looks at the list of medications regularly to make sure, and sometimes they change the roster, as it were.
Right, and your doctor should be able to tell you, your nurse should be able to tell you about that too. So ask, you know what, ask the question. Just ask the question. Yes,
and that was a good one.
Next slide.
Okay, now let's say you are enrolled in the healthcare system, you're utilizing the pharmacies. If you've been prescribed prescription medications, you're utilizing those and taking them regularly. Again, I want to stress, closely monitor all prescription medications. Make sure you're not going to run out at an inopportune time. Make sure you're requesting the refills before you actually run out, so you don't have that gap in your medication. Make sure you're tracking what medications you're taking. Again, the VA systems will do this for you, but you need to be aware of it, especially like you mentioned earlier. There are individuals who maybe sometimes they go to their private doctor and sometimes they go to the VA. They need to know what medications they're taking, because if one doctor prescribes something and doesn't realize, because they don't have awareness of what other medications you're on, that can cause problems for you. So make sure you're tracking and monitoring your prescriptions, not just what you're taking, but what you've taken in the past as well. I think we already mentioned you can expect 7 to 10 working days if you're going to try to call in or utilize the internet and refill your prescriptions. If you haven't received them in that time, then you need to talk, contact the pharmacy and let them know so they can give you a few to tide you over in the meantime, or they can make sure that the prescription being mailed to you is actually getting to you. So that's something you want to do. And another thing that we kind of don't really think of often, properly dispose of unused medication. If you have medication that you're no longer taking, bring it into the pharmacy and tell them, let them know. So I don't need this anymore. I need to dispose of these. We kind of get lazy sometimes. We throw them in the garbage, or we throw them down the toilet or whatnot.
That's bad.
Yes, that is bad. You shouldn't do that again. But
it goes out to the water system. Yeah.
Yeah, that's true. But that's another way you could utilize the pharmacies and the prescriptions from the VA. If you don't need it anymore, bring it in and let them know, and they'll properly dispose of it for you. Okay.
Awesome.
Okay. I think we.
All right. Do we have any questions or comments out there?
Bring them.
You guys have been pretty quiet. If not, then we'll go ahead and close it up. But first, please fill out the feedback. There's a feedback survey that you'll receive right after this, right after we close out the virtual coffee webinar. Please fill those out. It helps us get better each and every time. And I'm going to turn this up to the next seminar. Larry, when is the next seminar? will be sent out to you via email. So I'm going to send you a thank you email with a registration link to the next webinar, we're going to talk about prosthetics. And there's prosthetics that I didn't know were prosthetics, like ear hearing aids, and I didn't know that a wheelchair was considered a prosthetic. So those are kind of things that we're going to talk about, all about prosthetics next time. So I will send you out the registration link within the next day or two, and you can register for our next webinar, which is going to be, I believe, August 2nd. And we will see you then. Thank you.